in him, and according to a local doc, Senator John McCain is generally in good shape, and the tumor removal was from an easier part of the brain. The physician told me that should bode well for McCain in his newest battle, but I also learned just how tough it will be for the seasoned politician.
If we're going to stay here to work, then let's get some work done.
Senator John McCain on the Senate floor one day before he flew home to take care of a blood clot above his eye. More extensive tests revealed the man who survived imprisonment during Vietnam, who's represented Arizona for decades, and who's fought skin cancer, now is fighting aggressive brain cancer. It's called glioblastoma.
Well, it's the most common primary brain tumor in adults.
You deal with patients day in and day out who have that same diagnosis. What typically is the prognosis for a patient with a glioblastoma?
The usual number of people who can survive this and be cured of it is only about 5 or 10%.
Dr. John Brenneman is the Associate Director of the Brain Tumor Center at UC Health. He showed me what glioblastoma looks like on an MRI and explained why it's so challenging.
There are a lot of the areas in the brain where then you can't go in and surgically remove it, or there are limits to how much radiotherapy or chemotherapy you might be able to give to those areas.
He says glioblastomas can be resistant to treatment and tend to grow back. In an older individual, does a tumor grow more slowly?
There's some conflicting information about that, particularly from glioblastomas. So there is some information that actually suggests that it could be more aggressive in older people.
The 80-year-old McCain is said to be reviewing treatment options with his family. After surgery, a standard protocol would include radiation and chemotherapy. Do you have more hope today than you did, say, 10 years ago in the treatment of something like a glioblastoma?
I do. I think that what we're finding is that we're understanding better what makes these things grow. And the more we can understand how they grow, the more we may be able to intervene and manipulate that process. Manipulate
the process and stop it. Right now, UC Health is running a clinical trial for people fighting glioblastomas. It involves a drug that has shown success in attacking tumors in animals. Patients who are not responding to standard treatment are candidates. Trials like it are so necessary. The average survivability post-diagnosis for someone with glioblastoma is 14 to 15 months.